Fast-growing healthcare sector, rapid strides in medical technologies, state-of-the-art tertiary care hospitals, and most importantly, a vision to take all these to the people across the economic spectrum. This, in a nutshell, is the medical and healthcare landscape of Andhra Pradesh. Making healthcare accessible even to the poorest of the poor is quite an uphill task, as they are economically constrained. Health issue, even with one member, would deliver a catastrophic blow on the entire family. Government hospitals are too few to meet the growing healthcare needs, and many of them are not adequately equipped to treat all ailments. Even the poor have no other choice but to approach private hospitals for treatment.
As per the surveys conducted by World Health Organization in India, health is one of the most important reasons for out-of-the-pocket expenditure.
Since such care entails large out-of-pocket payments, they dread hospitalization. They are left with very few options: either suffer or succumb to the illness, either to borrow huge amounts or to sell their marginal landholdings and valuables. Such situations can be extremely devastating. What then is the best way to make healthcare available and accessible even to those who cannot afford it? This lingering question has led the government of Andhra Pradesh to come up with a unique program. A program that ensures delivery of quality healthcare to the poor. A program that could save poor families from the catastrophic health expenditure. A program that aims to realize the dream of healthy Andhra Pradesh, or Aarogyasri Pradesh. After piloting in 3 backward districts of the state in 2007, this community health insurance scheme was extended to the entire state in 2008. Aarogyasri, a health systems innovation targeted at the below poverty line or BPL population. Aarogyasri focuses on life-saving procedures for which specialist doctors and cutting-edge equipment are required. With coverage of a staggering 938 healthcare procedures spread across 31 specialties such as cardiology, neurology, nephrology, oncology, etc. Today, Aarogyasri is no short of a boon for over 23.3 million BPL families, 77.7 million people in Andhra Pradesh. All the poor and the needy can avail the scheme. Families defined as BPL and possessing white ration card can avail the scheme. The migrant poor or those who do not have a BPL card can also benefit from the scheme by getting a simple endorsement from the Chief Minister's camp office or referral centers by producing their photo identity cards.
Though I have a pink ration card, I came with my voter identity card and have been able to take treatment under Aarogyasri scheme. Because of Aarogyasri scheme, I have not had to suffer any financial burden. Otherwise, I would have been forced to undergo several difficulties by taking loans and trying to repay them.
The beneficiaries can access a range of hospital services for 938 medical procedures for free. The financial coverage is up to 200,000 rupees per family per year on floater basis. In addition, the patients get free food while being treated and cash for getting back home on discharge from hospital.
A to Z free.
This is a very wonderful scheme where I find patients who are absolutely poor, who can't afford anything. They come into the hospital, they get their diagnosis done and they get their proper treatment done, and then they go home and they even get a fare to go back to their village.
Regular health camps conducted under the scheme serve as means of reaching the grassroots level. General health checks and initial screening are done in such camps for referring the needy patients to the empaneled hospitals. Health camps are contributing a large amount of awareness. 104 helpline, working 24/7, is another gateway to patients to enter into the scheme.
Just by dialing 104, anybody can get the information about Aarogyasri. They can also register their grievances.
Considering that most of the beneficiaries need guidance through the procedures of hospitalization, a large number of facilitators called Aarogyasri have been put into place. These Aarogyasri are hand holders of Aarogyasri members. About half of over 3,500 Mitras are in the vicinity of the beneficiaries at the primary care centers. They handhold the beneficiaries up to the hospital and ensure the required follow-up on return. The remaining Mitras are the contact points at the empaneled hospitals and facilitate the admission and treatment procedures. They ensure proper and qualitative cashless treatment to the needy poor. Pre-authorization by the Trust is mandatory for all the cases. Hospitals have to submit the entire medical data of the patients, including reports, films, and video recordings online. Emergency approvals are given over telephone.
No paperwork at all. All the investigations are scanned and sent across on the internet to the Aarogyasri Trust, where another doctor looks at them, and then within 24 hours an approval is given so that we can go ahead with surgery. On occasions we had to take emergency approvals where patient was in a dire situation, and then it was a pleasant surprise indeed that within 5 or 10 minutes we get the approval and they just say, go ahead sir, this is life-saving situation, you go ahead and provide the evidence later. And then true to that, we could save quite a few lives because a decision was made on an emergency basis.
The two-level technical scrutiny of the electronic medical records of the patients help in quality service and fraud prevention. Hospitals must satisfy a range of requirements for getting empaneled under the scheme. On empaneling, they must have a dedicated RAMCO, Rajiv Aarogyasri Medical Coordinator. Provide space for Aarogyasri kiosk for Aarogyasri to ensure proper reception to the beneficiary. Regular evaluation and disciplinary actions against the erring empaneled hospitals reaffirm the commitment to public health.
We are very happy to be associated with Aarogyasri Trust. We are one of the network hospitals in Hyderabad. It's a boon for the poor patients since they will get the access to the best of the treatment available from the corporate hospital.
The Aarogyasri Healthcare Trust believes that the success of the scheme is enshrined in transparent functioning. It sees every responsible citizen, organization, media house and beneficiary as a stakeholder. The feedback from the beneficiaries, adverse reportage in the media about the implementation or any complaint by other stakeholders are taken up immediately and Trust acts suo moto to redress them. With an unstinted commitment to deliver quality healthcare to the needy, the governance and supervision of Aarogyasri scheme has been put in the able hands of an independent trust. The Aarogyasri Healthcare Trust is chaired by the Chief Minister and has members of other relevant ministries too. The day-to-day functioning of the Trust is looked after by a team of thoroughbred professionals and eminent doctors headed by a committed CEO. by restoring hope in many families, by making healthcare truly accessible to the poor, by bringing back the ailing manpower onto the productivity track. The Aarogyasri Healthcare Trust has truly won the trust of millions of beneficiaries in the state. Aarogyasri is today being lauded as a landmark scheme with a heady mix of the most active ingredients. No wonder its success story has now made many governments and international agencies sit up and study the feasibility of replicating it in other milieux. With a staggering 23.3 million BPL families as its beneficiaries, with a whopping 938 treatment procedures covered, with over 3,500 Aarogyasri to handhold the beneficiary, with over 425 top-notch hospitals empaneled, and with an impeccable track record of benefiting millions of poor, Aarogyasri is indeed a small step towards making healthcare accessible to the poor.
I work in a small private office as an office boy. One day, I suffered a heart attack, but because I had Aarogyasri card, by the grace of God, I got a surgery done. I did not have to pay for ECG, medicines or even food. It was all for free. I have got a new lease of life thanks to Aarogyasri. I'm a barber. Without Aarogyasri, I would have had to suffer a lot. My grandson is alive because of Aarogyasri. The doctors immediately admitted me when I showed them my Aarogyasri card. They conducted a free, thorough checkup and gave us free food, tea and tiffin. Those who had BP and sugar problems were immediately taken care of. For poor families like ours, Aarogyasri has done a lot of good. I'm a carpenter. From the time I got admitted on the first of the month, I saw several people who came with an Aarogyasri card be treated and sent home, sir. I have also become all right and can go home and earn a living. A lot of people are being treated because of Aarogyasri, thanks to Aarogyasri scheme.
And of course, a giant leap towards realizing the dream of Arogya Andhra Pradesh, or Healthy Andhra Pradesh.